Our children are in crisis, and when our children are in crisis, our families are in crisis. And when the families are in crisis, our community is in crisis.
People are suffering today. Our kids are suffering. We are all frustrated, we're confused, and we're increasingly unwell. While we can't change the healthcare system, we can change for us. We can become wellness consumers. We can be empowered through these small changes that will lead to big shifts.
Autism is a complex developmental disorder. There may be many different factors, including environmental and also genetic factors, which make a child more likely to be diagnosed with autism.
In 2016, the community needs assessment that was completed identified 3 areas of priorities, and mental health, behavioral health was one of them.
Indeed, today we are seeing a critical need to empower people with ways to heal their bodies instead of continuing to numb them.
I would imagine most all of us in this room know someone who's been touched by the tragedy of this opioid addiction. Now, the good news, medical guidelines, just within the last 2 and 3 years, have changed and now focus and call for non-pharmacological approaches to pain management. To put the odds in our favor, prescribe a way of thinking instead of a bottle of pills.
It starts first by how we, through research, advocacy, and education, support our children and their families to live their best lives.
How do we make a difference by connecting patients, consumers, to the right practitioners so that they can get the guidance they need, that they'll be able to hear and make the changes they want to make?
Our bodies talk to us on a daily basis and tell us what's going on with our mind and our spirit. Your intuition is really what connects you and helps you communicate with your microbiome, communicate on a cellular level. And now that we know so much more about the science behind the mind-body connection, diseases such as autism definitely can have a much higher quality of life and a higher functioning.
You all know probably your genetic sort of risks. Those genes are not the cause of disease, so you don't have to be afraid that they're just going to spontaneously do their thing. They have to be triggered, and they have to be triggered by the environment, by some kind of toxin or stress or radiation. It's the combination of our lifestyle and nutrition and our genetics that will be a very powerful tool for getting some answers.
This is systems thinking, and it's the heart of how we influence outcomes, is how do we look at the whole together. Help us on this movement to take small changes, big shifts, so that we could help our kids, so we can help our grandkids. There's a new day, and there is hope for what's happening, and we are the answer. We, collectively, whether you're an MD, a DC, a DO, an OD, a psychologist, a business leader, we can make a difference. Dr. Terry Walls, who has been recovering from MS, is a medical doctor, she says it's going to take us 2.5 to 3 generations to change the mess we're in. I'm up for it. I've got time, so let's get busy.